Okay, so this is a good example of somebody with a cavitary mass, but also a lung nodule. Actually, she has several lung nodules, and the trick is to not get so captivated by this cavitary lesion that you miss the lung nodule here in the lingula, and then she actually has one here, and it's hard to see, but there really is another one here, and there's probably a small one up here. Now, I know that because I know this lady's chest CT. But again, if you're methodical in how you look at an X-ray, you won't miss things. So let's start at the top. She's a little bit rotated. Clavicle is here. This one is a bit hidden. She is skinny, skinny. Notice that there really is no distinction between where her ribs end and where her skin is. This is a lady with a BMI of about 16. She's got little bitty bones. They're thin, little bitty clavicles, and very hyperinflated. If you were to count all of the ribs for this breath, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, maybe 11. I mean, this is a very hyperinflated, skinny person who, as you can imagine, has emphysema. She has flat diaphragms, she has a small heart. And this is a portable film again, so once again, the heart's going to look a little bigger, but on a regular PA and lateral, she has a typical vertical small heart. Now, she has a monitor on, so she's just had something done. Actually, this is a post-procedure X-ray. Trachea is here, what you're trying to look at after you've needled or biopsied someone's lung, which is what this X-ray was from, is to make sure they don't have a post-procedural pneumothorax. But if you're not careful, you would miss some of the things on here because you would be drawn to just see this big cavitary lesion, thick wall cavity, no air fluid level in it. Then there's some stranding below it. Pulmonary artery is here, but she indeed does have another nodule there, and she actually has at least one or two over here. There's no pneumothorax. The right lung was the one that was actually biopsied that day. So the post-procedural aspects is that this is a stable film, but this is a good example of how it's easy to miss some things because you focus on the obvious abnormality. The etiology of this lady's multiple nodules is not yet clear. They're all necrotic. So this could be a form of necrotizing vasculitis with granulomatosis, which used to be called Wegener's. It's so far not cancer or TB.